As I said, RN delegation, we're going to talk about this morning. And so for my students, you'll find the PowerPoint posted that on Canvas if you would like to have it. Otherwise, if you would like to have the PowerPoint that's posted with this particular video, just shoot me an email and I'll give you my email at the end of the video. Delegation is an important responsibility. The criteria for delegation has been set forth by the NCSBN and the American Nurses Association. When you delegate, it requires critical thinking and it requires a professional attitude. So when you delegate, what are you doing? You are transferring to a competent individual the authority to perform a selected nursing task in selected situations. But remember, it's key to remember that you as the nurse retain the accountability for the delegated task. So, what are you responsible for as the RN? You're responsible for the act of delegation, for supervising it, and for following up and deciding are there additional interventions that are needed. The 5 rights include the right task, the right circumstance, the right person, the right direction or communication, and the right supervision or evaluation. We're going to talk about each of these components in depth now. When you delegate a task, you need to ask yourself, is it the right task to delegate? You need to consider the Nurse Practice Acts within your state. You need to consider the scope of practice. You need to consider what was your job description? What are the laws, the policies, the guidelines that are set forth in your hospital? And you need to ask yourself, what are the desired patient outcomes? All these things need to be taken into consideration before you delegate a task, whether it be to unlicensed assistive personnel or a licensed practical nurse. There are many acronyms out there that can help you remember what you can and cannot delegate. One is simply do not delegate what you can eat. So that means don't delegate evaluation or assessment or teaching. Now within these, there's many synonyms that mean evaluate or assess or teach. So don't delegate the nursing process. Anything that is considered an advanced intervention requires collaboration, planning, and certainly don't delegate unstable patients. The right circumstance. You need to remember every situation is different. What might be considered the right circumstance one time might not be the right circumstance the next time. So just remember, what is the priority here? The priority here is safety. Okay, so when you are delegating a task, you need to look at the circumstances and you think, what is the expected patient outcome? Remembering safety is a priority. What are your patient's needs? What are the available resources? What supervision is needed? What's the skill of the individual that you're actually delegating the task to? These are all questions that need to be considered prior to delegation. Next, you need to consider the caregiver. What's the caregiver's knowledge and skill? What is their certification or license? How long have they been at your facility? Do they have actual validation or competency or demonstrated competency of their knowledge, the skill that you're asking them to do? You have to remember when you're thinking about the right person that you must not assign an unstable patient under any circumstances to a UAP or a licensed practical nurse. The next right is the right communication. Everyone needs to remember that everyone should know who they are assigned to, and that when we provide clear communication, it makes the workplace safer for your clients. So when you are delegating a task and you're communicating with the right person that you've delegated to, you need to ask yourself, is my communication clear? Is it concise? Is it complete? And is it correct? These should always be included in the directions that you guys are providing when you delegate a task. The final step is the right evaluation. Your job's not done yet. You need to follow up. You need to check the progress of the task that was delegated and monitor if it's been completed or not, and check the outcome. And you should provide feedback, usually positive feedback, when the task was completed correctly. You need to make sure that you remember that teamwork is key and that you should provide positive feedback. Now, if the outcome was not done or was not as you expected and the task was not completed as you expected, then you need to work together as a team and help with problem solving so that particular circumstance would not happen next time. And you need to respond to any feedback that is provided to you by the person that you delegated the task to. Just remember, the right supervision and evaluation is a key component and the last step in the 5 rights of RN delegation. As often as you can, you want to practice questions that have to deal with delegation. They will be part of boards, and you need to make sure that from the very beginning when you're in nursing school that you practice these particular types of questions, mainly so you can learn to identify the verbs and realize that there are many synonyms, as I said earlier, for the verbs that you need to be aware of. So let's just take a couple of minutes and go over 2 or 3 questions together. Okay, so in caring for patients with pain and discomfort, which task is most appropriate to delegate to the UAP? So we are talking about an unlicensed assistive personnel. So first, assist the patient with prep of a sitz bath. 2, monitor the patient for signs of discomfort while ambulating. 3, coach the patient to deep breathe during painful procedures. And D, evaluate relief after applying a cold application. So we're looking at the verbs, right? We have assist, we have monitor, we have coach, and we have evaluate. And we're remembering our acronym EAT. Do not delegate, evaluation, assessment, and teaching. So when we look at these, we realize that we have monitor is another form of evaluation, coach is a form of teaching, and evaluate obviously is evaluation. Therefore, we know in this particular question what we could safely delegate to the UAP would be to assist the patient with the prep of a sitz bath. Okay, let's look at another question. We have in caring for a patient with neutropenia, what task can be delegated to the UAP? It's one of the things that you guys love. Select all that apply. All right, so we have take vitals every 4, monitor temp elevation greater than 100.4, assess for sore throat, coughing, burning with urination, gather supplies to prepare the room for protective isolation, report superinfections, practice good hand washing techniques. We remember our acronym EAT. So take vitals every 4, take, monitor, assess, gather, report, and practice. Looking at those particular verbs, certainly take is not evaluate, assess, or teach. Monitor, though, is. Assess is part of the acronym. Gather supplies to prepare the room for protective isolation is not an example of evaluation, assessment, or teaching. Report is part of evaluation, so we would not delegate that, but practice good hand washing techniques is not. So we could delegate to the UAP that they could take the vital signs, gather the supplies, and practice good hand washing techniques. And our last practice question, we have an experienced LPN, so now we're talking about a licensed practical nurse under the supervision of the team leader, who is an RN, is providing nursing care to a patient with a respiratory problem. Which actions are appropriate to the scope of the practice of an experienced LPN? And again, one of your favorites, select all that apply. Remember, the acronym EAT still applies. So we can auscultate breath sounds, administer medication via an MDI, complete an admission assessment, check O2 sats using pulse ox, and initiate the nursing care plan. So when we look at these, auscultate breath sounds, certainly it does not evaluate, assess, or teach. Administer meds, absolutely. That is something that can be delegated to the licensed practical nurse. Complete an admission assessment. This is a little tricky because you look at the verb, it's complete. You think of complete, doesn't necessarily represent evaluate, assess, or teach, but we're looking at what we're completing, and it says the admission assessment. And so we know that we do not delegate admission or discharge assessments. Check the O2 SAT using a pulse ox, absolutely, and initiate the nursing care plan. And during the video, remember I said we are not to delegate the nursing care plan, so that would be a no. So we could delegate the auscultation of the breath sounds, the administration of the medications, and checking the O2 SAT. For those that are dropping by that are not my current students, just remember that you can get a hold of me at nurse.polly.rn@gmail.com. That's nurse.polly.rn@gmail.com. If you're one of my students, you know my school email, and I look forward to hearing from you guys. Have a great day, and just remember, breathe. Graduation is around the corner.